Imagine this, you are sick, you have worked hard for years, paid your insurance premiums on time, and you believe your healthcare bills are covered. But when the actual bill comes in, you are in shock when you see denials, not covered notices. You paid to be protected, but instead, you have become a victim of a $1 billion healthcare insurance industry. Let's understand how this game actually works. The US healthcare insurance industry is worth over $1.3 trillion a year. Insurance companies collect premiums from patients, negotiate rates with the hospitals, and reimburse the doctors for the care. At least that's what they say they do. But in reality, a huge chunk of your premium doesn't go to your healthcare cost at all. It goes to corporate overhead, marketing, lobbying, and sky-high executive salaries. For example, in 2023, the CEO of United Health made over $20 million in compensation. Cigna CEO made $21 million, Anthem around $19 million. That's the price of 300 nurses' salaries for one single person. Let's break down where your money is actually going. When your doctor bills you $100 to your insurance company, the actual amount they get paid after adjustment, denial, and delays can be as little as $20 to $30. And that's before covering their office rent, staff salaries, medical equipment, malpractice insurance, and taxes. Meanwhile, the hospitals negotiate much better reimbursement rates than small practices. That's why independent physician practices are disappearing and hospitals are swallowing them up. Next, we need to talk about corporate power and healthcare lobbying. So, why does this system stay the way it is? Because insurance companies spend millions of dollars lobbying Congress every single year. In 2022 alone, the healthcare sector spent over $700 million on lobbying. Insurance companies and hospital systems leading that pack. They push for laws and regulations that protect their profits while making it harder for physicians to get paid and for patients to get the affordable care. Some states now have prior authorization rules so strict that even urgent treatments they get delayed. Physicians are buried in paperwork just to get approval for a medication or a scan that their patients clearly needs. Physicians are being exploited, and I repeat, physicians are being exploited. Here's something more frustrating. Insurance companies and hospitals often use a physician name to bill patient at a full rate while paying that physician a fraction of what was collected. Imagine your doctor's name is on a $1,000 bill sent to you and you pay it thinking it's going to your doctor. In reality, the insurance company might pay your doctor some change and keep the rest under administrative fees and call it a day. You need to know who are the real victims here. This broken system bleeds both ends. Patients pay more than ever and doctors are getting paid less than ever. The average American family now spends $22,000 a year on health insurance premiums, deductibles, out-of-pocket costs. Yet many can't even afford to use the care they are paying for because of high copays and deductibles. Many doctors are leaving private practice entirely burnt out from fighting the insurance companies for every single dollar, trading medicine for mountains of red tape. Today is the call to awareness. We like to think our healthcare system is about people, but too often it's about profit. Patients are customers, they are revenue streams. Doctors are not partners, they are billable assets. If this makes you angry, it should, because nothing changes until we start asking that hard questions. Why are we paying so much? Why is so little of it reaching our doctors? And why are corporations making billions of dollars while both patients and physicians struggle? The more we understand the game, the more power we have to demand a system that puts health over profit. This isn't just about policy, it's personal. It's your health, your money, and your life, and it's time to fight for it.